According to the Centers for Disease Control, 1 in 5 U.S. adults lives in chronic pain.
Hi, my name is Erica Nicole Carrasco, and I live with the following chronic migraine conditions: hemiplegic migraine, migraine with brainstem aura, vestibular migraine, as well as new daily persistent headache. There are many types of migraine and headache neurological diseases. Even my kids have them.
Hi, my name is Emmett Henderson III, and I have the following chronic pain medical conditions: systemic lupus erythematosus, Sjogren's syndrome, encephalopathy of the brain, and interstitial lung disease.
My name is Eileen Davidson. I have the following chronic pain conditions: rheumatoid arthritis, fibromyalgia, osteoarthritis, and endometriosis.
Hi, my name is Brian Talley, and I have the following chronic pain medical conditions. I suffer from chronic pain syndrome, irritable bowel syndrome, neuropathy, IVDS, DDD, radiculopathy, severe voiding dysfunction, neurogenic bladder, bladder paralysis, cervical spondylosis, bone spurs in my spine, pinched nerves, and severe spinal nerve damage, all stemming from osteomyelitis and discitis.
My name is Diane Talbert. I have the following chronic pain conditions: fibromyalgia, psoriasis, and psoriatic arthritis.
My name is Evan, and I have the following chronic pain conditions: rheumatoid arthritis, fibromyalgia, radiculopathy, traumatic brain injury, spinal stenosis, and arthritis. I've had left shoulder surgery, 2 left hip surgeries, left knee surgery, and 2 neck surgeries that have left me in chronic pain.
Hi, my name is Tina. I have the following chronic pain conditions. I have Crohn's disease with multiple fistulas. I have arthritis, sacroiliitis, gastroparesis, pelvic floor dysfunction, as well as irritable bowel syndrome, degenerative disc disease, migraines, peripheral neuropathy, and sciatica.
I'm Al, a retired Air Force veteran living with the following pain conditions: fibromyalgia and arthritis.
I'm Crystal, and I am diagnosed with the following chronic pain conditions: fibromyalgia, arthritis, migraines, IBS, degenerative disc disease, neuropathy, and bilateral bursitis. Lucky 7. It's like I hit the jackpot, but instead of being given a cash prize, I've been given medical debt. Hashtag fact.
Disabling, dehumanizing, devastating.
Challenging, insufferable, excruciating.
Debilitating, consuming, unrelenting.
Living with chronic pain makes you feel anxious, lack of energy, and limited mobility.
Exhausting, debilitating, and heartbreaking.
Living in chronic pain is a repeating battle of waking up every morning after a fitful sleep and wondering, will I leave my bed today? As soon as I open my eyes, I usually know if it's going to be an exceptionally painful day or not. I mean, will the shower trigger an attack? Will brushing my hair? Cooking enchiladas for the family, maybe? Life is a constant question of, if I do this, will I end up in bed, in pain, away from my family?
Living in chronic pain is something no one should go through. This reduces the living a good quality of life and is life-altering. Living in chronic pain can bring depression, self-insecurities, and also suicidal thoughts.
I want people to understand that living with chronic pain is serious, and it has a big impact on my life, and it's not just my life that I'm talking about, but many others across the world who are dealing with the same experiences and difficulties of living with chronic pain.
Living in chronic pain is second by second, minute by minute, hour by hour, day by day. You have the good days, you have the bad days. The frustrating part about living with chronic pain is that you don't ever know when you're going to get a flare-up, and even though you may look fine on the outside, what's going on inside your body. Is what folks can't see. And once you have the flare-ups and the pain and all this stuff starts to go in, then you have the anxiety and the depression part of suffering with chronic pain. And even though you want to wear that brave face and tell the world, hey, look, I'm a warrior, it's difficult at times. So what I would want the world to know is, don't judge a book by its cover. Everybody has a story.
Just because I don't talk about pain doesn't mean I'm not in pain. Pain has been a big part of my life, just like getting dressed every single morning. I have been told by doctors, family, and friends that it's all in my head. Well, guess what? It's not and never has been. Just because I don't look sick doesn't mean I'm not. I'm not lazy and have to work twice as hard as you to get the same task done. I love you all, but I don't need suggestions or any other medical advice. Yes, there are people out there who are worse, and no, it's not cancer. But stop comparing us to other people. It makes us feel weak and not worthy.
I want other people to understand that chronic pain does not go away. Chronic pain is something that follows you around all the time. Now, I want you to understand that just because I have a bad day doesn't mean I'm not going to have good days. But I also really appreciate the support on those really bad days when I'm bedridden from doing too much from the other days. I want people to understand that behind the scenes, there's such a struggle between chronic pain and mental wellness.
Living with several chronic pain conditions is very difficult. Oftentimes it's invisible. Oftentimes we look very well. And most times we're labeled as pain medicine seeking. And I think that becomes really unfair for us to deal with, especially when we have multiple conditions that can cause severe and significant pain and alter our daily lifestyle.
Due to the misunderstanding of chronic pain and poor pain management of a person's pain symptoms, chronic pain is a risk factor of suicide. In fact, veterans living in chronic pain are 4 times more likely to die by suicide compared to the general population.
When looking at identified risk factors of suicide, chronic pain routinely is in the top 10 reasons as to why someone might die by suicide. In the United States, approximately 100 million people live with chronic pain, and stats have found that 27.2% of people living in chronic pain have experienced suicidal ideation or thought, and that does not include those living in pain who have died by suicide.
The most important thing I want doctors to know about living in chronic pain is that it's okay if you don't have the answers. But please don't make us feel like it's our fault and it's all in our head when testing comes back negative. Suggesting therapy should be done with empathy and prescribed as a coping mechanism for living in chronic pain and not suggested as a cure. Living in chronic pain is really hard, and therapy can be amazing for mental health when discussed in a really positive manner.
We need more than temporary relief. We need a cure.
I want doctors to know that living with chronic pain takes a lot out of a patient and that they have to treat us completely, not just our pain. That includes the emotional side, so mental health services are definitely very important to us, and that it also affects many different parts of our life, from work, socializing, parenting, you name it. I also want them to know that it happens to young people, and that just because we are young, that doesn't mean it's not serious.
I wish doctors had a different strategy when addressing pain patients. It's not a one-size-fits-all approach. Everybody is different. We all have different pain factors. We all have different pain levels. We all have different diagnoses that all result in pain. I would like to see doctors take a more hands-on approach and actually treat folks that suffer from chronic pain more effectively.
This is a message to all my doctors. I don't have to look sick to be in pain. Stop asking me if I have pain today and where it's at. Is this some sort of generic questions that all doctors ask? Chronic pain affects the whole body, not just one part. Sometimes just taking a pill won't work. We are not drug seekers. We just want pain relief. What would help me at this point in my life will be for doctors to acknowledge its disabling impact of chronic pain on us. There are days I can't focus or get out of bed. I might need a combination of treatments, so take the time to diagnose my pain and listen to me. I'm worth it.
I want doctors to understand that with chronic pain, we're coming to you to get help. We cannot get out of chronic pain. We're exhausted. We've done everything over the counter that we can, and we're now depending on you as the doctor to try to help us. Now, if there's a test that you want to run and the test does not give any definitive answers, I really want you to continue to invest with me to try to find out what else we can do. What else can we do to get me out of chronic pain? Please do not treat me like somebody that the test is done and the pain is gone. I need you to continue to invest to try to help me, and I want you to understand that I spend a significant amount of time researching as well, and I hope that you'll collaborate with me and not shut down being a Google doctor.
What I wish doctors would understand about living in chronic pain is that oftentimes these conditions are not labeled as pain-related conditions such as my Crohn's disease, but that they do cause significant pain. That just being put on medication for the disease, like Crohn's disease for instance, isn't enough to necessarily quell the abdominal pain that it might cause, especially during a flare-up. So I wish that would be something that they would take into consideration.
The annual healthcare cost of treating chronic pain is estimated to be between $560 to $635 billion per year. Yet, the treatment options available to manage chronic pain often do not have long-term effectiveness and come with a lot of side effects.
People living in pain, they matter.
My name is Erica Nicole Carrasco. I live in chronic pain, and I matter.
My name is Emmett Henderson III. I live in chronic pain, and I matter.
My name is Eileen Davidson. I live in chronic pain, and I matter.
My name is Brian Talley. I live in chronic pain, and I matter.
My name is Diane Talbert. I live in chronic pain, and I matter.
My name is Tina, and I live in chronic pain, and my story matters.
If you are living in pain, you are seen, you are loved, and you matter.